Hi, I'm Dr. Libby Darnell with Freedom Chiropractic Spine and Injury Center, and today we're discussing our knee pain program. And I can assume that if you're watching this video that you are somebody either experiencing knee pain yourself or someone you love is experiencing knee pain, and it's affecting your life. It's affecting a lot of aspects of what you're able to do from a day-to-day standpoint and probably taking away some of your joy. And that's why we exist, to help people that have literally tried almost everything else, and at the end of the day, they want to avoid being on long-term medications like gabapentin for pain relief and avoiding surgeries that are irreversible. So that's what we're going to discuss today. Now, before I get there, we're going to review what our actual knee pain program is. We're going to go over the benefits, the components. I'm going to discuss insurance coverage and your next steps. But I want you to understand a little bit about where our clinic is so that you feel a little bit of trust in where you're coming. So this is a view of Google Maps where you can see where we are located. So we're located in Spring Hill. We're right off of 396. So you can see that we're real close no matter where you're coming from. If you're coming off 31 or if you're coming off 396, we're really easy to access. We're right next to Fozzie's and Light Hill Meats right in Spring Hill. So we're easy to get to, and most of our patients probably drive about anywhere from 5 to 45 minutes to get to our clinic, especially if they're coming in for knee pain. They drive a good chunk because what we do is so unique and can't find it anywhere else in our area. This is what our facility looks like. We're update state-of-the-art clinic. We've got all the fancy toys and the fancy tricks to help people get well, and I'm going to show you some of those. But it's a nice place to come, and we pride ourselves on being not only a place that gets people well, but a place where you can really enjoy your time while we're there. We want you to be surrounded by good people that are there to help you and help you achieve your goals. This is our team. So we've got Tracy, you can see myself and my husband, that's Dr. Jeremy, and then also Dia. And we are office managers, we're chiropractic therapy assistants, and we're chiropractors. And my husband and I actually started 2 integrated medical clinics in Chicago where our main focus was knee pain. So we've been developing this system over the last 12 years, and we've narrowed it down to 8 components that, man, if you put those components together to get people out of pain, that's where the money is. And I'm going to go through some of that with you. But these are the people that you're going to be seeing when you're in the clinic. And we love our patients. We love it. And granted, we've seen people that have literally lost all hope and they come in kind of cranky. But by the end of the program, they're like, oh, this was the best thing. I'm so glad I took a leap of faith. That's our usual. That's who we're used to. So we're looking forward to meeting you and getting you started. So let's discuss knee pain in general. I mean, I know you're watching this. You know knee pain is a problem, right? 25% of American adults experience knee pain in the last 30 days. Just 30 days, that's huge. 14 million adults experience knee pain in 2018 total that are over the age of 45. We know that it takes away from people's joy. You know, you can't move around without walking on your knees, right? So your knees, if we start to lose our knees, we can lose almost every aspect of joy in our lives, which is why this is such an important problem. And current options aren't great, right? The current options in our medical system are not awesome. You know, we can be on long-term pain meds. We might do some physical therapy, which can be really helpful, but it can also be shortly lived, that eventually we're getting a knee replacement surgery, which is irreversible. You can have 2, and if those don't work, literally there's nothing else you can do, right? So the vast majority of people that we work with have seen what it's like to go through those things and not have good outcomes. And so they're like, I will do anything I can to eliminate this problem in a way that's actually going to heal the root cause of the problem. And that's what we do. So this is an example of an x-ray. On the left, you can see a nice normal knee joint space. See this nice dark space? That's where you've got a lot of structures in your knee that live. So you've got a meniscus in there, you've got ligaments, everything's kind of held together by the structures that live in this space. There's a lot of fluid in there. And then this white circle is your kneecap. And so you can see it's nice and centered right in the middle of the knee. Now over here, you can see this is where we've started to lose that knee space. So we've got almost a complete loss of knee space, especially on this side. And then you can see here that white kneecap has kind of moved off to the side. So we're looking at a lot of rotation that's happening in that knee, a lot of advanced degeneration. And a lot of people will look at this and go, oh, bone on bone, you got to have surgery. And that's not the case. What we are really exceptional at is doing an assessment to see where are you, can we help you? That is our main goal on our first visit, is to tell you flat out, are you somebody that we can actually help? We'll be honest with you. I mean, we're used to working with the worst of the worst, and we can help 80% of the people that walk through our door. And we're dealing with people with the worst of the worst needs, right? Who've tried so many other things. We can still help 80% of people. So I'm really hoping that you are one of them, but we'll tell you for sure. So we help 80% of the people that walk through our door achieve anywhere from 50 to 90% reduction in pain. And so, I mean, just think, if you're somebody who's in like 9 out of 10 pain or 8 out of 10 pain, and like this is constantly on your mind, even a 50% reduction is life-changing, right? But a lot of people, and it's all depending on how severe and how long the problem's been there. And again, we'll give you very realistic expectations. And our overall goal is not only to help get you out of pain, but stop that degeneration process. And we're going to talk about how we do that. We want to help you avoid surgeries, and everything we do is natural. There's nothing that we're doing that is synthetic or not native to the body, really. So these are the main components of our knee program, and I'm going to give just a brief overview because you're going to learn about them when you come into the office. But we do chiropractic knee adjustments, we do knee decompression, muscle rebalancing, which is so important, class 4 medical laser therapy, red light therapy, custom orthotics. You're given home equipment to use on a daily basis at home, and also nutritional supplements. And while a lot of those components, I mean, some of them sound advanced, and they are, and a lot of them are more simple, but it's really when you're putting them all together, again, that's where the magic happens. So tibial derotation is a chiropractic adjustment where we're literally, when you saw that x-ray and you saw that patella kind of off to one side, we're looking at the actual alignment of the knee. And for a lot of people, that is where it starts. You know, they trip funny once walking the dog. We've rotated that tibia, which is the bottom bone in your leg, and then boom, it never gets right again. It's never fixed, and we start that degeneration process. So if we can fix that right off the bat, that's what we're working on. So here's that bottom bone, and if this rotates, literally it stretches all of these interior structures, and then we start degeneration. So that's where the chiropractic adjustment is. So it's the foundation. And that has been something that's been missing from so many other amazing programs out there that might have some of these components, but it's missing this one. So then you can imagine, once we derotate, we get this bottom tibia back to where it's supposed to be, and you'll be able to notice this, I mean, almost immediately, some improvement, which is really, really cool. Then all these structures can calm down, and we can work on the rest of the components of the program. So another huge component is knee decompression. So this is, you can see an image of what it actually looks like, what a patient is set up, but here's an animation so you can actually see this is a patient and what is it actually doing within the knee joint itself. So we have the knee patient sitting on what's called our knee on track, and then we're decompressing or stretching out that knee joint. So you can see this knee joint, that red represents where we're getting a lot of inflammation and degeneration. And we're gently opening up that knee joint so that it's kind of like a sponge effect. You're getting all of the toxicity out of the knee, and then we're opening it up and bringing up new blood flow into the knee, new liquid into the knee. We're really just getting all the good stuff in and all the bad stuff out. Which is just such a wonderful tool to use. And people feel a difference with this right off the bat as well. Then we're going to work on our muscle rebalancing, where essentially we're making sure that all those really tight structures, so this is something that might typically be done in a physical therapy program, but where all of those really, really tight structures, our IT band, you don't need to worry about it. We find out what's too tight, what needs rebalancing, and we do that work, and we do that in the office at your appointment. Then we're also going to use our class 4 medical laser. So this isn't like a cold laser. This is actually class 4 medical laser, where we're getting both a thermal effect and a photochemical effect, where again, that blood flow is coming in. We're bringing in new oxygen, which every part of the healing in your body happens when we can bring in new oxygen into an area, new blood flow into an area. Because as you can imagine, when we rotate that tibia, we start that degeneration process, we have now stopped getting motion in that joint. So everything we're doing is getting motion in, getting blood flow in, getting oxygen in, and allowing that joint to heal. Then we're going to combine that with our light therapy, which is called photobiomodulation, but I'll go through more of the science on that with you when you actually come into the office. But this is something that we do at the same time as we're doing our knee decompression. Again, stimulating ATP production, which is energy production, reduces inflammation, provides immediate pain relief, but more importantly, tissue repair over time. Another component is our customized orthotics. I want you to look at this graphic. So when we get pronation, which is dropped arches in the feet, so you can kind of see that here, someone's going to notice that now we're starting that rotation again in that lower part of the leg. We're going to start favoring one side, and we have these kind of multiple effects that happen. And we don't want to see that, right? So what we're going to do is put in a custom pair of orthotics that help completely stabilize that patient. And I cannot tell you how many times people have said, I want to do all of it, but this one. And it's like, oh, this has such a magic, almost immediate effect with people that they love them. They're like, oh, I don't want to do it, but I will. I'm just going to trust you. And then they feel so good just walking around immediately. So this is another really great component. Now, depending on the severity of your issue, we've got a couple of different home therapy pieces that we'll use. So on your first visit with us, we'll do an assessment and we'll see which of these devices do you need, or do you need a different device. But you will have something that you are using at home that you will get to use for life. So even after you're done with your program with us and you're feeling so much better, it's just like wearing braces. You did your intensive therapy. Now we got to wear a retainer. We got to make sure that you're not just going back to doing the same things that got you in trouble in the first place. So we're going to teach you all of that. We're going to teach you everything we don't want you doing, everything we want you doing, and this will be one of those components. We're also going to have some nutritional recommendations as far as an anti-inflammatory diet. We do want to reduce your overall body burden of inflammation. And then nitric oxide is one of the supplements that we'll use. It's so amazing for getting blood flow back to the area, increasing circulation to especially like your ligaments in your knee that it's hard to get circulation back into that area. This is another component. Would any of these things work completely to get you out of pain on their own? No, it's when you combine all of it. So this is really, it's such a vital component of our program. This is not like an over-the-counter supplement that you can get anywhere. These are really designed for people that are having these knee issues. So you can imagine when we kind of circle back, we're completely talking about bringing circulation into this area, taking stress and pressure off of all of these ligaments, your meniscus in here, opening up that space and derotating to get proper alignment into this knee. Then we're going to help stabilize that knee outside while you're going through. We're throwing everything at this knee joint. It's not just, you can think like, we're not just doing a cortisone injection in here, right? Where cortisone injections might make you feel good for a little bit, but then increase your likelihood of degeneration over time. We're not doing that. We're doing things that are actually going to bring healing into this area, which is why we're so excited about this. Now, if you're on our website, you can read, we've got so many great reviews. We have only 5-star reviews on our website, which is so great. And people love coming there. They love the actual experience of being in our office, but they also love the results that they get. So you can definitely take a look at all of those testimonials. Now, these are the most common questions that I get. Any other questions, I'll be happy to answer for you in the office, but will it work? So that's our job. On day one, I'm going to tell you, can I help you? Yes or no? I mean, if you've got, major bone spurs that are hitting that meniscus and you have to have surgery to go in and clip those off, I'll tell you. If you've got such advanced degeneration that there's literally no space at all, you are truly bone on bone, I'll tell you that. Because so many people think that's the case, and I show them their x-ray and it's like, no, you're not. We've still got a lot to work with. So that's my job. That's my team's job, is to tell you, can we help you or not? And we will be very honest. Last thing we want to do is start somebody in our program that we're uncertain about and then have you be disappointed. So we're going to be very transparent because we want to be able to help the people that we can help. And if we can't help you, we're going to point you in the right direction. Okay. Another thing is time. How much time does this take? In the beginning of care, ligaments don't heal. They don't even start to heal for 4 to 6 weeks. So people will feel a little different initially, but I'm not expecting big leaps and bounds for at least the first 6 weeks. But give us at least 3 months. Plan on mentally 3 months. Now, I'm not seeing you every day. In the first couple of weeks, I want to see you 3 times a week for about 20 minutes. And then we'll taper off over time. So plan on at least 2 times a week there for a couple of months, and then we'll get down to once a week. And again, about 20 minutes a visit. And then you're going to be doing some of your home therapy. We're going to give you home exercises that we want you to do. We're going to boss you around. All you have to do is follow the instructions, but plan for about that time frame. Now, depending on the severity, it could be a little bit less or a little bit more. Now, insurance and cost. So unfortunately, insurance does not cover the components I just went through. We do work with insurance with a few other services that we provide at our office, which we may or may not recommend depending on what you come into the office with. But plan for the components of this program. If these are recommended to you, they're not covered by insurance, and your cost range could be anywhere from, at the lower end, $3,000. And if we're doing both knees and this needs you need a lot more time than what I had recommended originally, it could be upwards to $7,000. We do have lots of payment plans. So even though those costs, I know it's a high cost, I want to prevent surgery for you. I want to prevent long-term medications for you. We'll do everything that we can to put you on a reasonable payment plan that this is not taking away from any other aspect of your life that's also important. So we're going to work with you to make sure that this can fit. So with that said, any other questions that you have, I'm going to answer those at your first evaluation, which that next step, you just need to schedule that first evaluation. Make sure that you're bringing in your spouse or partner or anybody else, because I want to hear from them too. I always get a lot more information from them too, because they get frustrated, right? When you guys cannot go on a cruise, or some people want to go to Disney World, that's tough, right? So they're almost just as frustrated as the person in pain. Bring them in. I will also make all of my recommendations, and my team will make their recommendations as well on your initial visit. So we're going to lay out your whole plan, get you scheduled. You'll know what your cost is. We'll find a payment option that works for you. So make sure you're bringing in your partner, and give me a plan for at the most 2 hours, depending on how many questions you have, but at least an hour of your time for that initial appointment. And I promise you, if you give me 100% of your effort, my team and I will give you 100% of your effort. We cannot wait to be able to have you be one of our miracle cases.